This is the Post-Acute Care Center at the Hebrew Home of Greater Washington.
My introduction here was wonderful. It was friendly. They made you feel right at home.
We begin your discharge plan even before you arrive.
Our goal is to get you back home.
The Hebrew Home is conveniently located on a beautiful campus. We have wonderful spaces for the residents to use during their stay.
The medical philosophy of the Hebrew Home revolves around person-centered care.
We make the admissions process easy by having clinical liaisons out in the hospital to assist with the transfer.
We create a partnership between the therapist and the patient, and it starts with working on their basic self-care skills, but then it moves through their recovery.
The majority of our post-acute rooms are private rooms, and there is no additional charge for a private room.
Our philosophy at the Hebrew Home of Greater Washington is to give compassionate, individualized care to our patients and families during their recovery.
The therapist's object was to get people up and walking and get them back to as close as they could to what they were before.
We're able to collaborate with each other in an interdisciplinary team approach with nursing, with therapeutic recreation, and with therapy, so that those patients' goals are worked upon all day long.
The Hebrew Home employs its own physicians. They exclusively work only for Hebrew Home and take care of residents only at Hebrew Home. So their interest is the residents' highest quality of care.
We have 30 full-time therapists that work one-on-one with their patients. That's physical therapy, occupational therapy, and speech therapy.
But I found the nurses here to be exceptionally friendly and also concerned.
Our facility always wants to partner with our family members in taking care of our patients and helping them through their recovery to their full potential.
They were able to tailor a program for my needs to build me up.
The way that we motivate our patients is by really listening to what their goals are, what their dreams are, what their hopes are, what they need to be able to do to go home. And then we tailor our treatment sessions focused on those goals.
There is a discharge planning team that's coordinated by the social worker, or what we call the case manager. They'll determine what the needs are in order for you to safely go home.
The best part of my job is seeing patients recover and become an active participant in their lives again.
It's a great satisfaction knowing that as a nurse I can help them through their recovery.
We measure success by the smiles we see on our residents' faces every day.
Nothing makes me happier than
Seeing our patients
walk out the door
and get back home.
We have a great track record for getting people back home.
Our goal
is to get you
back home.
Back home.
back home.
The Post-Acute Care Center at the Hebrew Home of Greater Washington welcomes you.